Go.
Yeah. Yes.
Good afternoon, Miss Larson. My name is Adeshia, and I will be a nurse for today. I will be giving you, let me check your ID band first. Okay, Millie Larson. All right, I'll be administering 2 medications to you. The first one is Practifurosemide 20 milligrams IV push every 12 hours, administer over 2 minutes. Flush with 3 ml of normal saline before and after dose. Okay. This is it here. Furosemide 20 milligrams IV push every 12 hours, administer over 2 minutes. Flush with 3 ml of normal saline before and after dose. 1 furosemide 20 milligram IV push every 12 hours. Administer over 2 minutes. Flush with 3 ml of normal saline before and after dose. Furosemide 20 milligram IV push every 12 hours. Administer over 2 minutes. Flush with 3 ml of normal saline before and after dose. Okay. And also insulin Lispro 10 units subcutaneous with breakfast. Insulin Lispro 10 units subcutaneous with breakfast. Insulin Lispro 10 units subcutaneous with breakfast. Okay. All right. Okay, so I'm going to draw down the medications and then I'm going to administer it to you. All right. So first, okay, I'm going to take the insulin Lispro 10 units sub-Q with breakfast. Okay, I'm going to clean off the top. Okay, I'm going to take my insulin syringe. It is 1 ml 29 gauge times 1/2. This is insulin syringe. They say they give I have to give 10 units. Okay, so I'm gonna okay. I'm gonna take off the cap. I'm gonna pull it down to 10 units. Okay, I'm gonna push down 10 units of air into it, and then I'm gonna drop the 10 units. Okay. All right, I'm gonna take out the air, flick out the air. Okay, so that's 1. Okay. Then I'm going to this is the hub of the IV, the catheter. I'm gonna take the alcohol and I'm gonna scrub the hub. Okay, scrub this part. All right, and then I'm going to administer 3 ml of saline flush. Now this is a 10 ml flush. I'm going to administer 3 ml before I give the medication. So 3 ml will be administered here, and then we'll be left with 7 ml until after I give the dose, and then I give another 3 ml. So I'm going to start. No. So I'm going to draw down the medication for the IV push. Okay. I'm going to clean off the top. Okay. Discard. And this is, they want 20 milligrams IV push, and this is 100 milligrams per 10 mg/ml, which when you work out the calculation, it is 2 ml. I'm going to take my 3 ml needleless syringe. Okay, I'm going to attach it to a 22 times 1.5 inch needle. And I'm gonna take this off, okay? And then I'm gonna draw up the medication in here. Bring it down to 2 ml. Okay. Push the 2 ml of air in and draw up the medication. Okay. This is 2 ml. I'm gonna flick out the air. Okay. All right. And now I'm going to do hand hygiene, and I'm gonna put on my gloves and administer the medication. So, put on my gloves. The first thing I'm gonna do is administer the insulin. I'm gonna take my alcohol prep pad, clean from inner to outer. Let the site dry. I'm gonna administer the 2 inches. I'm gonna administer the insulin in the abdomen 2 inches away from the umbilicus. So I'm gonna pinch the skin, and I'm going to prick the skin at a 45-degree angle, pull back on the needle to see if we have any blood return, which is none, and I'm going to inject the 10 units of insulin and pull it out slowly. Then I'm going to discard the needle, and then I'm going to wipe the area. Okay? Then I'm going to discard the gloves and do hand hygiene. Okay? Next, I'm going to put on a new pair of gloves. And for the IV, the IV push, I'm going to take off the hub. I'm going to scrub the hub with alcohol. After I scrub the hub with alcohol and let it dry, then I'm going to take my needle and I'm going to take off the top, discard it, and I'm going to attach the needle to the hub and give first of all, I'm going to give 3 ml of the saline. And then, after that, I'm going to take my needle and I'm going to inject the furosemide 20 milligrams. Okay? And I'm going to do it slowly and watch the patient's reaction. After I do that, then I'm going to take another alcohol swab and scrub the area. And then I'm going to take my flush and a 3 ml of the saline again. So 3 ml before and 3 ml after. And then I will discard my gloves and do hand hygiene and discard the rest of my equipment. Okay? Thank you very much.